Hello, everyone. My name is Andre Ferreira, and I'm a third-year medical student at the Baylor College of Medicine in Houston, Texas. Before I begin, I would just like to acknowledge my colleagues, Dr. Hung, Dr. Ghanta, Dr. Harrington, and my supervisor, Dr. Halawi. This project would not have been possible without their help, and I'd also like to thank the journal Arthroplasty for giving us the opportunity to present our work here today. Today's presentation is over a recently published paper titled Spinal Anesthesia is a Grossly Underutilized Gold Standard in Primary Total Joint Arthroplasty, Propensity-Matched Analysis of a National Surgical Quality Database. And before I begin, neither I or any of the authors have any relevant disclosures at this time. And as always, the data and materials of our study are available upon request. And here now is just a brief outline of today's presentation. And now jumping into the background here. As you all may know, there are various types of anesthesia that are used for total hip and total knee arthroplasty, with general and spinal anesthesia remaining the two most common types. In the current literature, there's little discussion about the outcomes associated with each type of anesthesia and how these outcomes compare to other anesthetic methods. And the few studies that do address this topic are generally done in single hospital institutions with small sample sizes. Today, there's currently no clear consensus on which anesthetic method is the most optimal, and usually the choice of anesthesia mostly comes down to the provider preference. What we do know from the literature is that spinal anesthesia is generally associated with lower healthcare costs. And also, this last point here of the slide, in light of the recent COVID-19 pandemic, the choice of anesthetic method became a very important consideration. Many hospitals experienced a surge in ventilator usage during the height of the pandemic, and general anesthesia became difficult to perform due to the lack of resources. So this setting sort of reveals a niche for the usage of spinal anesthesia, as this method can reduce dependence on oxygen and ventilation. So now briefly, these are the objectives of the study: to compare and contrast the postoperative outcomes associated with general and spinal anesthesia in patients undergoing total hip and total knee arthroplasty, and compare the utilization rates of general and spinal anesthesia in these patient groups. Now here, regarding the methods of our study, we retrospectively queried the ACS NESCOT database for patients undergoing elective total hip and elective total knee arthroplasty between 2015 and 2018. We identified the procedure based on CPT codes, and patients who did not undergo either general or spinal anesthesia were excluded. Additionally, patients who did not undergo elective hip arthroplasty or knee arthroplasty were also excluded. And this left us with roughly 307,000 patients for our study. We then separated the data set into two groups based on which method of anesthesia was used, whether it was general or spinal. And then we propensity matched the two groups using nearest neighbor matching. And we ended up with two groups of 103,304 patients based on the type of anesthesia used. And you might notice that roughly 100,000 patients were removed after matching. And now after matching the two groups, we used multivariate logistic regression and multivariate linear regression to calculate postoperative outcomes for both groups. The outcomes we focused on in our study were complications, length of stay, and postoperative discharge, whether they're being discharged to home or discharged to a non-home facility. Now here, it's a big table, and I'll just walk us through it. These are going to be the demographics and characteristics of our two groups. So as you notice here, after matching the two cohorts, we ended up with p-values all non-significant, meaning both groups were matched based on comorbidities and perioperative characteristics. So both groups were as homogeneous as possible before we began our study. And we used general anesthesia as the control group. Now this slide here showcases the results from the multivariate regression models. Briefly, there's two large columns here. We actually separated total hip and total knee arthroplasty into two separate regressions so we can do them independently of one another. And as you can see, spinal anesthesia was associated with less postoperative outcomes and a non-home discharge after controlling for demographics and comorbid conditions. And this holds true for both total hip and total knee arthroplasty with significant p-values here. Additionally, spinal anesthesia in both groups was associated with a shorter length of stay. You can see that here in this last row of the table. When looking at the length of stay, you can see that spinal anesthesia is associated with a significantly shorter length of stay, as I mentioned, but this only holds true for the total knee arthroplasty group. So patients in the total hip group actually didn't experience any significant differences in length of stay. And sorry, I forgot to mention the discharge to home. Patients undergoing spinal anesthesia were less likely to be discharged to a non-home surgical facility after operation. Now, briefly here, this is a table indicating the utilization rates of spinal anesthesia between the years 2011 and 2018. As you can see, in 2011, about around 36.7% of THA cases underwent spinal anesthesia, and around 40.5% of TKA cases underwent spinal anesthesia. You may notice that as the years go on, there's not a significant increase nor decrease in spinal anesthesia usage. We're hoping with the results in our study, there'd be an uptrend in usage, but this just reflects a disparity between the current literature and perhaps clinical practice. If the current consensus was that spinal anesthesia was the more optimal form of anesthesia, we'd hope to see an increase over the years. And now, going on to the conclusions to conclude our discussion. Our study shows that spinal anesthesia is associated with more optimal outcomes and should be considered as the gold standard method of anesthesia for patients undergoing elective total joint arthroplasty. And another important consideration and conclusion is that through reductions in length of stay and a non-home discharge, spinal anesthesia can actually reduce resource usage and overall healthcare spending. And as we all know, this is especially important during such a tumultuous time, such as the COVID-19 pandemic. And as with any study, our study definitely has some limitations. First of all, it's a retrospective review, making it prone to any errors in data input. However, we did try to choose a database that's very commonly used in orthopedic literature and has a very robust validation process. A second limitation is that postoperative outcomes assessed in our study are only limited to the first 30 days after surgery. As we know, there can be complications that occur afterwards. So any complications that do occur outside this window are probably going to be underestimated in our study. The third limitation lies in the potential selection biases for each treatment cohort. With any database, there's variables that aren't written or variables that you can't see. That definitely influence whether or not a patient received a certain type of anesthesia. We use propensity matching to try to minimize any selection biases, but as always, there's going to be some potential for bias in any study. And as always, future research can help expand the results, and we encourage people to try to replicate the study and see if they can find some similar results in their own cohorts. All right. And that concludes my presentation. Thank you all for your time today, and thank you to all the organizations that helped make this possible. Have a good rest of the day.